students, let us discuss about the Azygos system of veins. The objectives for the discussion is, at the end of the discussion, you should be able to understand the meaning of the word Azygos and the components of the Azygos system of veins, the peculiarities of the Azygos system, and the Azygos vein, hemiazygos vein and accessory hemiazygos vein will be discussed under the subheadings of formation, course and termination, relations, tributaries, development and clinical importance. The word Azygos means unpaired or single or without companion, and it consists of Azygos vein, which is seen on the right side, and the hemiazygos and accessory hemiazygos veins on the left side. And in this picture you can see the superior vena cava and inferior vena cava. These two are connected by means of the Azygos system of veins. The peculiarities of the Azygos system of veins are they are straight, they are paravertebral in location and not accompanied by corresponding arteries. In this picture you can see the Azygos vein, which is straight, the hemiazygos and accessory hemiazygos veins. These are seen on the left side. This is the left and this is right, and on the right side is the Azygos vein. So these are straight in direction. They are paravertebral on either side of the vertebral column, and they are not accompanied by corresponding arteries. They have valves. They drain the blood from back and from thoracic and abdominal walls. They communicate anteriorly with the vena cava system, superior and inferior vena cava, and posteriorly they communicate with the vertebral venous system. Coming to the formation of Azygos vein. It begins as lumbar Azygos vein from the back of the inferior vena cava. This is inferior vena cava, and this will be at the level of right renal vein. And this lumbar Azygos vein is joined by a vein which is formed by the union of the right subcostal vein at the level of T12 and the right ascending lumbar vein. So you can see in this picture the lumbar Azygos vein originating from the back of the inferior vena cava and is joined by a vein formed by the right ascending lumbar vein. This is the right ascending lumbar vein and right subcostal vein, and this union of these two veins will take place at the level of T12 vertebra. Coming to the location of the Azygos vein. It is in the upper part of posterior abdominal wall and posterior mediastinum. So this is the Azygos vein you are seeing, and this vein you have seen in the previous picture. It communicates with the superior and inferior vena cava anteriorly. So, vena cava system anteriorly, and posteriorly it joins the vertebral venous plexus posteriorly. And the important collateral channel for connecting the superior and inferior vena cava is the Azygos vein. And in this picture, you can see on the left side the hemiazygos and accessory hemiazygos veins, and these are seen in relation with the vertebra on their lateral aspect or in the paravertebral space. Coming to the course and termination of the Azygos vein, and you can see the Azygos vein in this picture starting from the inferior vena cava on its posterior aspect at the level of the renal veins. These are the renal veins, right and left renal veins. This is the right side you are seeing. This is the left side. Okay. So starting from there, it will ascend up into the thorax. So via the aortic opening in the diaphragm. So it will enter the thorax and runs in the posterior mediastinum in front of vertebral column, that is anterior to the lower 8 thoracic vertebra. Then it will arch above the root of right lung, which you can see in this picture. So you are seeing the right main bronchus, and above that you can see the Azygos vein arching over it. Okay, and this is at the level of T4 vertebra. So it arches above the root of right lung at the level of T4 vertebra, and then it ends in the superior vena cava. So it terminates in the superior vena cava. So the arch of Azygos vein, the arch it forms, okay, is a content of middle mediastinum. Variations in the termination of Azygos vein are possible. It can pass via apex of right lung. That's what is happening here. And as it is passing via the apex of right lung, it is splitting it into two parts, a medial part and a lateral part. And the vein is lodged in a fissure and is suspended by a mesentery of pleura. The medial part of apex will be called the lobe of Azygos vein. This is called the lobe of Azygos vein. That is the variation that's possible, the termination of the Azygos vein. The embryological explanation for the lobe of Azygos vein is which is a normal anatomical variation of upper lobe of right lung, and it shows an incidence of 1%, and the Azygos venous system develops from part of posterior cardinal veins. The right posterior cardinal vein is lateral to the apex of right lung, which you are seeing in this picture. So it is lateral to the apex of right lung. That is the normal position, and from there it is migrating medially over the apex of the lung. So the failure of this medial migration of posterior cardinal vein, that is the future Azygos vein, gives rise to the lobe of Azygos vein, which you see in this second picture. So the Azygos lobe is separated from the rest of the right upper lobe by the Azygos vein, which you are seeing in this picture. So this Azygos vein is lying in the fissure known as the Azygos fissure, and it is enclosed in a mesentery which is derived from the mediastinal pleura, and this mesentery is called the mesoazygos. So hope you have understood the embryological explanation for the lobe of azygos. So the right posterior cardinal vein will penetrate the right lung. That's what you are seeing in this picture, carrying along with it the two pleural layers that invaginates into the upper portion of the right upper lobe. So this mesoazygos, it forms an indentation of the lung, and its overlaying pleural layers by azygos vein and forms the mesentery, so which consists of two folds of parietal and two folds of visceral pleura. And what is the clinical importance of lobe of azygos vein? During thoracic surgery, for surgical planning and decisions, for example, in thoracic sympathectomy, the lung tumors, the spontaneous pneumothorax, or pulmonary sequestration, identification of the lobe of azygos vein is important. And also for respiratory care physicians, it is important for therapeutic drainage of secretions from the azygos lobe. In this X-ray, you can see the right lung near its apex, showing the azygos fissure, and in its lower part you can see the azygos vein, this dark impression separating the medial azygos lobe. So now you understood the importance of the lobe of azygos vein. In this CT image, you can see the right lung. This is the right lung and this is the left lung. And in this transverse section, axial view we call it, and this is the coronal view. And in relation with the right lung, you can see the azygos lobe. This is the azygos lobe. And in this view, coronal view also, you can see this is the apex of right lung, and you can see the azygos fissure and the azygos vein, and this is the azygos lobe. Hope you have understood about the azygos lobe and its clinical importance. Coming to the relations of the azygos vein. So in this picture, you can identify the vena azygos or azygos vein, and anterior to it you will be seeing the diaphragm, the esophagus. This is the esophagus you are seeing, and the fibrous pericardium will be anterior to it with the oblique sinus of the pericardium, and the left atrium and root of right lung. We are seeing the structures forming the root of right lung. So these are anterior relations. So the anterior relations are the diaphragm, the esophagus, the fibrous pericardium, oblique sinus of pericardium, and left atrium, and the root of right lung. And posterior to it, you can observe the lower 8 thoracic vertebra, their intervertebral discs, and the anterior longitudinal ligament. These are the posterior relations for the azygos vein. On the right side will be the greater splanchnic nerves, and the right lung and pleura will be related to it. On its left side will be the thoracic duct, the right edge of esophagus, the trachea, the right vagus nerve. These are the relations on its left side. Coming to the tributaries of the azygos vein. This is the azygos vein. You can identify in this picture, and it receives the right posterior intercostal veins except the first vein. So except the first vein, which will be entering into the right brachiocephalic vein, which you can see in this picture. And you can see the other posterior intercostal veins that are joining the azygos vein. This is the azygos vein, and here you can see the arch of azygos vein. You can see where it is entering into the superior vena cava. Then it receives the right superior intercostal vein. So that will be draining the second, third and fourth intercostal veins, posterior intercostal veins that are entering into it. Then 5th to 11th intercostal veins, if you see here, they are ending separately. Whereas the 2nd to 4th, they are joining and becoming the right superior intercostal vein, which is entering into the azygos vein. The venous trunk formed by the union of the right subcostal vein and right ascending lumbar vein, that is also joining it, and which itself may form azygos vein, which you are seeing in this picture. So coming from the left side is the hemiazygos vein, which we will discuss a little later. So you can see the hemiazygos vein joining the azygos vein at the level of T8 vertebra. Then the accessory hemiazygos vein, which is also joining the azygos vein at the level of T7 vertebra. Then the other tributaries which it receives are the right bronchial vein, it will receive, and then the esophageal, the pericardial and mediastinal veins also join the azygos vein. Hope you understood about the tributaries of the azygos vein. Coming to the development of the azygos vein. It develops from supracaudinal veins. So in this picture you can see the veins of the body wall. At first they drain into the posterior caudinal vein. Later the major part of posterior caudinal vein gets obliterated. So the drainage of the veins of the body wall will shift from the posterior caudinal vein to the supracaudinal vein. The supracaudinal vein, which becomes the azygos vein. So you can see the azygos vein from the supracaudinal veins, and which is connecting with the posterior caudinal vein in its cranial part. And caudally you can see it in contact with the or communication with the inferior vena cava on the right side, and on the left side you can see the mirror images of the azygos vein, which is divided into the hemiazygos in the lower part and accessory hemiazygos in the upper part on the left side, and which will join the azygos vein. So the venous drainage of intercostal spaces or on the right side, 4th to 11th intercostal spaces, they drain into the right supracaudinal vein, that is the right azygos line vein. And then these together with part of the, that is the right supracaudinal vein, along with part of the right posterior caudinal vein, will form the azygos vein. Whereas on the left side, the 4th to 7th intercostal veins, they drain into the left supracaudinal vein, and which is known as the accessory hemiazygos vein. And on the left side, the intercostal spaces from 8th to 11th, they drain into the hemiazygos vein. So this is the hemiazygos vein and this is the accessory hemiazygos vein. So the azygos veins are developmentally or from the right and left supracaudinal veins. On the right side it is a single unit, whereas on the left side, though it is a mirror image of the right azygos vein, it will be divided into two parts, the lower hemiazygos vein and the upper accessory hemiazygos vein. Coming to the clinical importance of azygos veins. So alternate path for blood to the right atrium. The azygos vein, which is running up along the right side of thoracic vertebral column, is draining towards the superior vena cava, and it is connecting the superior and inferior vena cavae. So it can provide alternate path for blood to the right atrium when either the superior or inferior vena cava is blocked. That is the clinical importance of the azygos vein. Now let us see what is hemiazygos vein. It's also known as the inferior hemiazygos vein. This is the one hemiazygos vein which you are seeing on the left side, and it is the mirror image of lower part of the azygos vein. And this is also formed by the union of the left ascending lumbar and left subcostal veins. They will join and form the hemiazygos vein. It can also arise from the posterior part of left renal vein. In this picture, you can see it being formed by the left subcostal and left ascending lumbar veins. Coming to the course of the hemiazygos vein. This will also pierce the left crus of diaphragm and ascends on left side of vertebral column, and it is overlapped by the aorta. At the level of T8 vertebra, it will turn to the right and it passes behind the aorta, esophagus and thoracic duct to join the azygos vein. So that's what you are seeing in this picture. Then what are the tributaries of it? That is the left ascending lumbar vein, the left subcostal vein and the lower 3 or 4 intercostal veins of left side. You can see it. So you can see the 3 or 4. So 8 to 11 posterior intercostal veins or joining the hemiazygos vein. And you can see its formation from the left subcostal and left ascending lumbar veins. Coming to the accessory hemiazygos vein, which is also known as the superior hemiazygos vein, and it is mirror image of upper part of azygos vein, which you can see in this picture. It is the continuation of the left fourth posterior intercostal vein, and it will be running down on left side of the vertebral column, and at the level of T7 it turns to the right and ends by joining the azygos vein. Sometimes it may join the hemiazygos vein. The tributaries of the accessory hemiazygos vein are the 5th, 6th, 7th and sometimes the 8th posterior intercostal veins of the left side, and the left bronchial veins also join this accessory hemiazygos vein.